This is Dr. Suren Chavan from Sarkar Nagar. I would like to talk on dyslipidemia today. Dyslipidemia means bad lipids are more, good lipids are low. That is high LDL, high triglycerides and low high density lipoprotein, which is a good one. So what is the real trouble? Nobody gets any symptoms if patient is hyperlipidemic. It has to be diagnosed in laboratory by doing the lipid profile test, 12 hours fasting, and then we check the levels. The normal levels of cholesterol is 210 mg per deciliter. High density lipoproteins should be more than 40. LDL should be less than 150, or if the patient is diabetic, hypertensive, it should be less than 100. VLDL should be low. And the triglycerides, particularly in Indians, are very high. We are genetically prone for a triglyceridemia, so that has to be taken care. Symptoms, there are no symptoms again. So what is the risk with this thing? You are prone for coronary artery disease, you are prone for diabetes and getting a lot of complications. So that is why we should reduce the lipids. How to reduce lipids? There are a few ways. The best thing is to do exercise first. You should be very active lifestyle. Diet should be controlled, and few other things like, say, you are diabetic, more of a sugar control, and if you are alcoholic, you are definitely going to get lipid disorders. In the diet, there are few things. Cut the animal proteins like mutton, chicken and other things, and fried food, potatoes, chips and other things. Eat good food like fruits and vegetables. Why? Because LDL is oxidized, and to reduce the level of LDL, you have to take antioxidants which are normally present in fruits and vegetables. Then eat good fats. The trans fatty acids are in the potato chips and fried things and burgers and other fast food. They should be avoided, and it should be replaced by the good fat, either by olive oil or avocados and curry tail and other things. Then eat garlic, French fries, legumes, whole grains, and plant sterols. Psyllium should be more. In exercise, though we reduce your LDL by 10 to 15%, you may not get more than that. So exercise is one part. Even if you do for years together, the only reduction in the LDL will be 10 to 15%. If you really want more than 30% or something like that, you have to go with the medicines. Like will be helpful. The complications of hyperlipidemia, it is prone for getting heart disease like coronary artery disease, layman's term heart attacks, diabetes, and its complications. Stroke, we can call. To reduce this complication, you have to treat it. The diet and exercise, though, for one part, it should be treated. Most common treatment is statins, that is atorvastatin, rosuvastatin, pivastatin and other statins. Niacin is one good thing. It increases your HDL and reduces the low density lipoprotein. Niacin is also getting from the food, but getting a therapeutic dose is difficult, around 500,000 to 1.5 grams. It causes flushing and other things. Statin itself has some problems like getting muscle cramps, the most common side effect, and now it is said it is a diabetogenic. So even with treatment you have to be very careful. This is enough.
Thanks.
To do the control is reduce your calories by 30%. By reducing calories and reducing fat, you are reducing your weight. So less weight, less complications. Your body mass index should come down. And exercise you should do at least 30 minutes. Avoid tobacco, avoid smoking, avoid alcohol. And daily regular exercise of 30 minutes is very important. This is in short. And the final thing is, the recent study in the Lancet has shown that 60% burden of the cardiac disease or heart disease are with the Indians. So we have to treat dyslipidemia very aggressively, and we have to promote things in all media.